So what that means is that this will be available to the public on our City of Longmont YouTube channel. So just want to make sure that we share that. Then you will all, there will be I will be the timer and will provide 15 minutes after you guys introduce yourselves. And primarily it's Q&A from our board and myself, but if there is time at the end of the 15 minutes, we'll go ahead and give you a chance to share whatever you want to share. So let me introduce our board members real quick. We got Catherine Onaka, she's a board member. Kimberly is a board member. Graham is actually our vice chair. So we want to put that on his title, Brenda. He is the vice chair of the board. I'm going to turn it over to you, Maria, and you can introduce your team, and then I will start the timer.
Sure. I'm Maria Stepanian. I'm the executive director at the Center for People with Disabilities. And I'm here with Jude, our director of development and communication, and Heather, our director of core services.
All right. I'm going to go ahead and hit the start button. All right, our timer is on. Board, if you have any questions you want to start off. If not, then I can go ahead. Oh, Graham, you want to start with a question? Go
Sure. Thank you all for the work you do over there at the Center for People with Disabilities. I appreciate it. I guess I have two questions. The first one is about best practices, and it looks like in your response to the question about whether or not you use and how you use best practices, you sort of just referred to your own longstanding history as an organization and servicing this community. And I'm wondering, are there resources outside your organization, whether or not it's research or other organizations in other areas that perform similar work that you might look to or could look to make sure that you're doing the best practices?
Yeah, absolutely. So there are 9 centers for independent living like ours. Those are organizations that are certified as Center for Independent Living, meaning that more than 50% of staff and more than 50% of board members are individuals with disabilities. And the organization is consumer control, providing services based on the need of people with disabilities in the community. And there's 5 core services that those certified centers provide, and along with other criteria that make an organization to be a certified center for independent living. So there are 9 in Colorado and over 400 in the United States. So there is a large network, local and national, and there is independent living research utilization organization that does a lot of research and technical assistance and support to make sure that best practices are shared nationwide with all the SILF, meaning Center for Independent Living.
Okay, cool. Thank you. That answers that question. And then the other one was in your logic models. I was just struggling to kind of see what specific outcomes were being measured. I mean, it definitely sounds like you're having conversations to determine sort of the effectiveness of your program activities. But maybe I just would seek for some clarification or encourage you to come up with specific outcomes there.
Maybe I'll try to respond to that one, Graham, if that's okay.
Yeah, of course.
So, as Maria mentioned, we're a Center for Independent Living. It's a unique organization, so we're not prescriptive. We're not doing case management where we're telling people what they need to accomplish or performing it for them. But actually, self-advocacy and peer support are huge tenets of our philosophy. And so when a person with a disability comes in and seeks to increase or achieve independence, we help them assess their own independent living goals. So that might be moving into an apartment, it might be learning transportation, it might be getting mobility training. It might be having a landlord tenant. They might be getting a job. So it's hard to have a one size fits all in terms of outcomes. So we talk about goals set and goals met and progress towards goals. And the way we measure that is if each individual is making progress, we're tracking all of our activities in our database. And then that's the way we get individual measurements, but we can't really report those individual measurements as a set outcome for the program. And then so we do these consumer surveys twice a year where we track whether they've increased their independence. The overarching goal is to increase independence or achieve independence. And then we can measure a percentile of people that have accomplished that as an overarching goal. I don't know if that clarifies it a little bit, or if you have a follow-up question, if I didn't get your first question clearly.
No, I think you clarified it perfectly. Thanks, Jude.
Okay.
So I have a question, and I want to caveat this, and I've done this with all the agencies before. So you know, when you all apply, both board and staff see the same application, but we have different roles in reading the applications. Whereas Graham is and the rest of the board are looking at your programmatic piece, looking at outcomes and goals. Not that I don't look at that, but my focus is more at the agency level, at governance, at finances. And I had a couple of questions. I'm not sure if this was done in error, but there is nothing on your board demographics, like there's no numbers at all. So we don't know how many board members you have. So I wanted to ask about that first. And then I did want to give you kudos on your strategic goals. I thought those were really strong, but just wanted to check in on that board side.
That's probably an error because I was compiling a lot of different spreadsheets and stuff to provide the whole demographics for the staff, the board, the consumers, our prospective consumers, and all that kind of stuff. So can I follow up with you and send you something?
Yeah, that would be great. If you could do that, that would be I'd appreciate that. Because yeah, I didn't see anything on there.
Yeah, that's probably an error. But just to let you know, on this call briefly, we have 9 board members.
Okay.
How many are Longmont residents, Maria? Is it 2 or 3?
3 for sure.
3 for sure.
Yeah. And all have very diverse backgrounds that they come with, personal and professional.
Yeah,
Okay.
and most, the majority of our board members are also persons with disabilities. We also do have representation of various different ethnicities and language users as well, to the best of our ability. I mean, we prefer to recruit people who have significant experience with independent living. But let me follow up with you, Eliberto, and I apologize for that.
No worries. I figured that's probably just, I mean, yeah, there's a lot of stuff that we asked for, so I figured that was just an oversight. And then the other question I had, and of course I'll give time to the board if they have other programmatic level questions. I think the other question I had was around, I wrote down here that, and it's not necessarily a bad thing, but I just wanted to have a conversation about it. When I look at your agency budget, when I look at your revenue streams, I mean, it is highly government dependent. And just wanted to have a conversation of that. And I'm sure the board understands that, but just kind of wanted to get your thought on, is there thoughts or is there actions on trying to diversify that, or is that kind of your model, the very government dependent type of agency?
Yeah, good question. It is government dependent, and we are actively increasing fee-based programs. One of those programs that we currently have that is doing very well, and we hope to expand more, is the veteran-directed care that we provide. That is a program funded by the VA, and is based on fees that we receive rather than a contract or a grant model. So it's a fee-for-service program. And we have 2 other similar programs that are for individuals with disabilities seeking employment. This one, the veteran-directed care, is for veterans with disabilities that would like to remain at home and live independently at home and receive care at home by the individual they choose to receive the care from. The other programs are employment-based programs and funded by Social Security Administration and DVR, Division of Vocational Rehabilitation. So those are our fee-based programs that we are actively expanding and definitely making sure that those lines continue providing unrestricted funding sources from those fee-based programs.
Okay, yeah, that will make you more sustainable because you just never know with the federal government, if it has a shutdown and, there's no, a budget doesn't pass, and what happens to your grants and contracts with the government. It gets harder. Okay. Does the board have any more questions on the program side? So I have a not so application question. I know Diane Groff has retired. How do you replace that leadership in Longmont? What have you done? What's the work? Because I mean, she was a staple and a leader. So how do you replace that?
There is no way to replace Diane. No way to replace the amount of knowledge and expertise she had and the connections in Longmont. This 38 years of serving at CPWD and living in Longmont. There is no question that's a very hard position to replace. I currently and have lived in Longmont for the last 12 years. So I'm a Longmont resident myself. We have board members that are Longmont residents. They have the location still on a main street and have staff members working from that office. And we continue participating at the St. Vrain Community Council meeting where I saw you, Alberto, last time.
Yeah.
So we continue doing what Diane was doing and continue being in networking opportunities and in places where we need to be to make sure that people know about our services and we hear back communication from the community. So with the current staff and board members, we are making sure we continue our presence.
All right. So, Graham, go ahead.
Sure, I think we got 5 more minutes or
Oh,
so.
Yeah, around 3 or something.
Yeah. Can you give an example of when you've used a response from these surveys you get from your participants to make an improvement or a change in your services?
Yeah, hey everyone, this is Heather. I can take that one. We just are working on compiling our satisfaction survey now, and we definitely see people wanting in-person services again, which is exciting to see. So that's what makes me really excited for the future of Longmont and our office there. It's heavily drop in. We've seen that even though we're only by appointment only, technically we're actively working to get open office hours because that's what people want, and we're excited for that. Especially in Longmont, I think that the need there is huge. Just the location of our office is amazing. Maria was on a shift there one time and took some drop-in folks herself. So I think the future is very bright for that.
Cool, thank you.
I'll just add briefly, one very specific feedback that we received and took action on in Longmont was a request for peer group to restart. The peer group that always wanted to be only in person. So when we shifted to online due to COVID, that group decided not to meet online. And they have come back saying, hey, we're ready to come back. We want to be in person again and continue. And that has been reestablished now again, weekly peer support group in Longmont.
Awesome.
All right, so if there are no more questions from the board, we have about 1 minute 30 seconds left. If you all want to end with you, anything you want to share with us?
We would love to thank you all for doing what you're doing and continuing to be a partner and supporter of the work we are doing, so we can serve our community to the best of our abilities. So thank you, and you're always welcome to visit us. We would love more than 20 minutes to share all about independent living history and the movement and the amazing work that people with disabilities have done and are continuing to do. So you're always welcome to connect with us outside of this 20-minute please.
All right. Well, thank you all. Have a great rest of your day and night. We appreciate all that you do here in Longmont.
Thank you. Bye-bye.
Thank you.
Okay. This will go by fast. There'll be a lot of agencies tonight, but it goes by fast. Thank you all for the questions, and yeah, it's gonna go like that. So yeah, once I get their board numbers, I'll share that with you. I mean, like, again, it's one of the things that I score, but I know it also plays into how you all look at the agency. So I just saw that it was missing, and I didn't have a chance today. Usually for these type of things, when I see it, I tend to email beforehand so they can have it ready by the meeting, and I just didn't catch it this time, and or early enough to email them. And yeah, so my apologies for not catching that. Is our next group ready? Brenda, are they here?
Not yet. We don't
Okay,
have anybody
so-
waiting yet.
Okay, well, good. We're doing good on time.
Mhm. I did ask them to come in a couple minutes before so that we could let them in right away, but
That's fine.
Can you remind us who's next? I just wanna.
Cultivate should be next, I think.
Okay, great. Thank you.
Yeah, let me look at the agenda. That is on the thing. Cultivate, el comité, intercambio, Mile High, out Boulder County, our center. And I know you're gonna step away from that, Kimberly, just so I'll know. Kimberly, the subcontractor for the R Center, so she'll be recusing herself from scoring and the session, which is fine. I just need at least 2 scores to have an average. I don't want to have just like, which is what I did for the staff, is I asked a couple of other division managers to score, so it wouldn't just be my score. You know, when it was Karen and me, we could at least have an average. And so that's what I did for the staff side of it. I asked a couple of other folks to review and score the grants. I think my piece is a little bit easier because I'm just looking at financials and governance. I think you all have the harder job of looking at program outcomes and ensuring that the programs are in line with our priorities and stuff like that. So if I can have at least 2 people score each agency to have an average, that makes me feel that we feels good about, you know, our scores. That's kind of the other, not necessarily a downside, but you know, difficult part of not reading every is that we don't have tons of scores for each, where we usually have, you know, 7 to 8 scores per each agency. Now we have 2 to 3. So things that we can talk about after we get done with this process and review how we think it went. Is Cultivate here, or should we consider, do we need to email them? We haven't had, by the way, we have not had any agency miss so far, which has been great. I think last year we had a couple of agencies miss.
actually, I don't have anything. I was just checking my email to make sure they didn't email having any issues to hop on or anything, but let me send something out to them.
All right, thank you. Yeah, last year we had a couple of folks miss. This year we have not had a single person miss, which has been a wonderful thing to have. It's always awkward when an agency misses their hearing, and unfortunately, according to our policy, they are automatically disqualified from human services funding, which is why we always check in with them, email them the day before, just confirm. We try and do our best to get them. But sometimes people have had issues with the link for some reason. I'm not sure why, but there have been a few people who Brenda's been contacting that have some issues with the link.
She just hopped on, so I'm going to send her in.
Perfect. Great. Right on time. Hey, Christy.
Hey, Alberto, how are you?
I am doing well. Thank you for joining. I'm going to go through some housekeeping stuff real quick, Christy, and then I will turn it over to the board. First, let me introduce our board. We have Graham Steers, who is our vice chair, Catherine, board member, and Kimberly, board member. Yeah, just so you know that this is a public hearing, and so this is being recorded and will be available on YouTube, our City of Longmont YouTube channel at some point. You will have 15 minutes of question and answer time. If we get done with our questioning earlier, or if we don't have any more questions, whatever time left, we will turn over to you for you to share whatever you think is important for the board to hear as they review and score your application. With that said, I'm going to let you introduce yourself, and then I'm going to start the timer.
Sounds wonderful. My name is Christy Britt. It's nice to meet you all. I am the executive director of Cultivate.
All right, I'm starting the timer now.
I'll get started with a question. Thank you for all the work you do, Christy. Appreciate it. I do definitely appreciate reading your application that you're sensitive to the varying technological competencies of the group you serve, and so kudos to you for trying to adapt to that. I guess there was one area of concern I had in your application that I'd like you to speak to, and that is out of the 360 folks in the city of Longmont, 325 are white, and that just doesn't feel in alignment with the demographics. Can you talk a little bit about why that is and what you might be doing to address that?
Absolutely. That is one area that we have continuously struggled with, just in general. We have found, I think most nonprofits have, is that, the people who are able, or those who can access the services easily do, they tend to be the white population. We have tried many things over the years. We continue to try to find better ways to reach out into more racially diverse communities. We've spent a lot of time over the last many years specifically in the Latino population, working with El Comité. We had a program specialist that actually had some office hours there. It was typically every other week, just really trying to build that trust, build that just recognition. And we do have a very good relationship with service organizations of non-white populations, but we just haven't found, and we continue to explore. I mean, I don't have the answer. I mean, I'll be upfront right now. I don't have the answer. We don't know what that answer is. We continue to explore, is the question of, is it because culturally?
Well, I think you froze, Christy. Uh-oh. Not sure if we lost her.
She's still frozen. I don't know if I can push her out and then have her come back in.
So, just send her an email saying that we lost her and see if she can jump back on.
She did. So.
Okay, here we go. Hey, Chris, if you need to turn your camera off for bandwidth, because I know that's an issue, that's fine, as long as we can hear you.
Okay, yeah, I'm not sure what happened. That has never happened to me before. I'm sorry.
Yeah, sometimes bandwidth could be an issue, so don't worry if you got to turn your camera off. That's fine.
Okay, let me just keep trying, because I don't have anything else running. If it happens again, I definitely will. Let me go ahead and pick up. Apologize for that. So back to, we don't know what that answer is. Is it just culturally, and how, people view family and seniors? They don't need our services. Is it that we're not reaching out in the right ways? So again, those are areas that we continue to explore with with community leaders, with our board members, with different chambers and things like that. So it is kind of a non-answer in that I don't know the answer. But we continue to try, and I believe with our new and not new in practice, but new in our publicly, stated and a real plan of action for our diversity, equity, and inclusion initiative. Certainly, we are continuing to try to find those mechanisms or find whether they're answers or more relationship building in order to better change that demographic.
Okay, thank you, Christy. Appreciate it.
Kimberly, go ahead.
Thanks, Christy, for meeting with us. I had just a quick question about the needs assessment, and I was curious when your most recent assessment was done and what needs have you identified?
Sure. So we follow along with the CASOA, the Community Older Adults Survey. I don't think I got all the letters right, but that's put out by the Area Agency on Aging for Boulder County. And so they're in the middle of doing one right now. And we do work really closely with the Area Agency on Aging to make sure that the needs that we are filling are true needs. And really over since the last CASOA survey, which I believe was in 2018, the needs really they stay pretty much the same. Housing, of course, transportation, with COVID and even still after that, the grocery, access to healthy nutrition. So we do continue to watch that, where we've encouraged all of our clients and community to take the CASOA this go round as well, so that we can continue to make sure that we're aligned with the needs of the county.
Thank you.
So actually, I had a great answer to my question, because you just talked about the caravan, and I asked this. I think it was last week we did food and nutrition, and I had one question for. There were several agencies that, as part of their application, talked about food delivery. And of course, Longmont Meals on Wheels, that's all they do. But tonight we're going to be talking to Via, who does food delivery too. And so I guess my question is, because just a caveat, my role as a staff reviewer is I review, your governance, your board, which by the way, you're at 22% people of color, which is great. I know that's an increase. I want to talk a little bit about that as well. But I also look at your partnerships and your unique services. And I guess the question is, there are multiple agencies now doing some sort of food delivery. I think you guys do groceries. The farmers market does WIC grocery bags and others. So I understand the different populations, but have you had any conversations with other agencies that are doing this kind of work around best practices or areas that there could be potential coordination?
So we've had conversations as far as referrals, if you will, and it's because access to nutrition is such a huge need, and we do each fill a separate niche within that. So for example, earlier this year, and this was in Boulder, but one of their food pantries was looking for a way to get delivery to some of their clients. And knowing that Via does, because they do the pickups, where somebody would order, say, Quick List, so they're going to use the grocery store's existing app. So I connected them like, hey, they might be able to help you because they're doing those ready-made delivery orders. So we're definitely referring back and forth as far as that goes. We're all doing it in a much different sort of way. Meals on Wheels definitely doing the prepared food. So we are constantly referring clients back and forth to each other, because in addition to prepared food, perhaps clients want their own groceries, so that maybe they only have the ability to cook, once or twice, or maybe they just have, they just want some snacks, which Meals on Wheels isn't delivering. Our program is different in that we just, we allow that choice because we're doing the actual shopping. So we're not leaving it up to the King Soopers employees to do the shopping.
Oh, okay.
So that's where the differences lie. We did explore trying to use the so kind of what Via's doing is that the client's putting in the order to King Supers. Via goes and picks that up and goes and delivers it. We explored doing that, but it just wasn't. It didn't give that personalized service that our clients need. And that's really that ability for our volunteers to make that choice because we know our clients and we've gotten to know them. We are able to call them right there in the store to say, hey, they don't have blueberry muffins. Would you like cranberry muffins? Silly example, but we do that a lot to really make sure they're getting that personalized need filled. So it is all just a little bit different. One of the biggest reasons we chose not to do or we didn't pursue the King Supers like click list further, and I just use King Supers because they're our main partner, is that they were charging that fee, and we know that many of our clients can't afford even $4.95 per order kind of fee, and we didn't have the ability for those on-demand volunteers, if you will, because we have our set days that we deliver. So ours is just a very standard, kind of like the delivery always shows up Monday morning. Our groceries are always going to show up in Longmont on Tuesday. So it helps in that overall landscape of grocery delivery and of access to nutrition, and really that independence of choice, giving our clients the opportunity to pick how they want to receive their food and their meals within what the other offerings of the other organizations do.
Right. Yeah, because I asked this community food share because they have their elder share program
Yes.
as well, right?
So we actually did explore that partnership as well. And our clients were not interested in those prepackaged boxes. And that goes back to that freedom of choice for, what it is that they want. For some of our clients, they were interested, and then I know community food share, I'm not sure if they're still doing it, but they had piloted kind of a delivery program, and we'd sent them some clients that would be a good fit for that program. So again, we are talking all back and forth to make
Good.
sure that we're not duplicating and we're referring back and forth. And I truly believe that all of us at the core are really just trying to get that choice to really fill the clients and what they want, because certainly when somebody is very low income, having that elder share box of food can be a lifesaver. But for those who can afford a little bit more to have that choice, that's really what they want, to hold that independence.
Okay. And I guess my last question is, so I think I'm not sure what it was before last year. I probably have to go back, but your board of directors now is at about 20% people of color, a little bit more. What are you all still working on to try and increase that or maintain that level of engagement from diverse members of the community?
Definitely. Yeah, we're going through a big rollover right now. We have several board members that are rolling off and are choosing to pursue others. So as we continue to recruit and look for new board members, we are asking, we're talking with the people that we know that are myself, my several board members, and looking for specifically those people of color to replace and or refill, so that we continue to have that diverse representation and thought on the board.
Make sure you ask the comité to help you find board members.
Yes.
They're your partners there. So those are my questions. We have about 1:40 seconds left. I'm not sure if the board has any other questions. If not, we can turn it over to you to finish this out. Oh, Catherine, go ahead. Oh, you're on mute. There you go.
There we go. I was just wondering how you find your volunteers for your clients, and if you had enough volunteers to meet your clients' needs.
Ooh, we find them any way we can. We are out at all the events we can possibly be at, whether it's farmers markets. We'll have a table at the Aging and Altitude Expo for specifically for volunteers. We're out in the community. I have 2 specific outreach staff that are out there really just recruiting volunteers. We always need more volunteers. We really try to keep the volunteer and client volume growing equally so that we don't have a wait list of clients. So as we get more volunteers, you know, we push for more clients. If we get, you know, an influx of clients, and we're really pushing for volunteers. So we can really we can serve as many as volunteers as we have available, if that makes sense. So yeah, always we'll need more volunteers, and we will find more clients to fill their time as we get them.
Thank you.
All right. We got a few seconds left. Christy, anything else you want to share?
Really just excited to, you know, if you guys, I know I put the link on there. I wasn't able to put our diversity, equity, inclusion commitments in there. But we're really excited. We've opened that up to our staff and our volunteers to really just help our community understand how important it is to just, you know, be that inclusive organization. And we've always done that internally, but you know, we realized we didn't have an external component, you know, of really externally stating that commitment. We've done a ton of trainings, you know, we continue to follow up. And so that's something we're really excited about, and excited to see some of the new surveys that are coming back in, because I think we will better represent our community once we get that demographic information after explaining why we're asking for it.
Okay. All right. Thank you very much, and have a good rest of your day.
Excellent. Thank you. Bye-bye. Thank you.
Bye-bye. Right. Our next is El Comité. Not sure if they're in the waiting room, but they're the
I only
next.
have Donna there. I'm expecting Riley as well.
Oh, they're grant, right? Okay.
If you want, we can add Donna and see, maybe they'll
Yeah.
hear from her tonight.
That's
Okay.
fine. If they're ready to go, we can go.
Oh, we're muted. Okay, we're still muted? No.
Hey, Becky. I can't see Donna, but I think she's there. Now I can't see anybody.
What's in the way? My cup. Okay,
Oh,
hold on, dude.
and there's Trudy. Who else is there?
Hey, come this way.
Riley.
And Riley's.
And there's Riley. So it's a big old party. All right. Welcome to you all. Thank you for joining us tonight. I'm gonna do a little bit of housekeeping first, and then we're gonna go ahead and get started. So first of all, just want to let you know that this is technically a public hearing, and thus is being recorded, and can be found hopefully soon at our City of Longmont YouTube channel.
Okay.
I'm gonna introduce our board members.
Okay.
First, Graham is our vice chair, and Kimberly and Catherine are board members.
Oh, what happened? There we are.
Yeah, I can see you guys.
She moved the mouse.
Oh, so we are. I'll be the timekeeper, and we'll be about 15 minutes of question and answers, and then if there is time at the end, if we're done with our Q&A, we will turn it over to you all to share whatever you feel you need to share.
Okay.
But first, let me have you all introduce yourself before I start the timer, because there's 4 of you there.
Hi, I'm Donna Lovato. I'm the executive director here at El Comité.
Hi, I'm Becky Berkelo, and I'm on the board here at El Comité.
Hi, Trudy Navarro on the board, the treasurer here at El Comité.
Hi, I'm Riley Nelson, and I'm the development coordinator and grant writer.
Awesome, great. I'm gonna go ahead and start the timer, and we'll see if the board has questions. I know I have questions, so I'm gonna go ahead and start it now. Oh, all right, Kimberly first, and Graham.
Thank you so much for meeting with us tonight. The primary question I had in reading your application were, what models are you currently using for best practices? What research have you based your work on?
Wow, that's an interesting question. Mostly what we use is working with the Latino Foundation of Colorado, kind of the stuff that they use when working with people of color. I know. Okay, I think it changes all the time. So when we do, for example, the driver's license stuff, we use the stuff from the state of Colorado. When we're doing the ESL classes, we use it from the Colorado. We use their curriculum, the state's ESL. Yeah. When we do the citizenship, for example, we follow the INS. What is INS?
Immigration.
The Immigration and Naturalization Services. So we use their stuff, their application, their questions, their workbooks that they suggest. So different ones. So it depends on what it is that we're doing.
And I would say overwhelmingly over the top of all that is the fact that this organization strives to treat everybody with respect and dignity, because sometimes the folks who come to see us have not been treated that way. So for us, it's about comfort, and it's about dignity, and it's about giving them back a little bit of their power. And I would say to you, that's the majority of where we work from here at El Comité.
And you got to remember that we do a lot of referrals out. So when we're dealing with the woman with domestic violence, for example, we're not the specialist in domestic violence, but she comes here once a month or twice a month, don't quote me on that one. And we set up, it's still been through Zoom, but for example, mental health comes here. And so we don't pretend to be therapists or any of that nature. We just set up the appointments with them, and we assure them that they're safe and that all their information is confidential. And because they trust El Comité, they will trust mental health, and they will trust safe shelter. So I don't want to say we use their standards, because they do. All we have to do is make sure we make the proper referrals. Does that make sense?
That's yeah, very helpful.
Graham.
That ties in nicely with my question. Thank you, Donna and team, for all the work you do. I appreciate it all. But my question is, when you make those referrals, do you have a mechanism for following up to ensure that connection was made and that relationship was fruitful on the other side?
We do, but because of confidentiality, they can't really tell us much. They can say, yes, we're meeting with them, and that's all we can know. So whether it's a HIPAA thing through mental health or the confidentiality through safe shelter. Now, if they come to us and it's something with the school district, for example, or the police department, we do follow up with the client, not necessarily the police department, to see if they got their needs met. We also, on our intake sheet, we have a little on the way bottom, it's like follow up, yes or no. So if they got their needs taken care of, they rescheduled their court date, we don't have to follow through with it. But if it's something that we need to kind of make sure that they did, yes, we call them and say, did everything get taken care of? So
Okay.
Yes.
Great. My other question is, what does the development coordinator do? Like, what's the roles and responsibilities there?
It changes every day, Riley. So this is Riley, and we can both talk. And I think part of the important thing is that you need to understand, Riley came in as a student intern, and she was my assistant. So she did a lot of stuff, helped me with a lot of stuff. And then I've been working with her over a year on grant writing. So she's the primary grant writer. She writes them. We talk about what are we going to apply for, and then she writes it. And then I review it, and she sends it and does all the follow-up. She's also, we changed her title to development coordinator, which encompasses the grant writing, because we hadn't done any kind of fundraising because of COVID. Everything kind of had stopped. And so we just had our annual fundraiser. You want to talk about that?
Yeah, we had it on August 20th at the Boulder County Fairgrounds. And we had about 130 to 150 in attendance. And we're still finalizing numbers, but should I say?
Yeah, about.
We made about 29,000 on that. So yeah, for a couple months there, my role was focused on planning with the board and Donna for the fundraiser. And then yeah, the rest of my role is mostly fundraising through grants. And then it's also some social media and starting to be a little bit of reaching out to donors. Yeah, it's a new role. So we're like starting to get into more of that. I'm doing a development training. It started last week for the first session with Colorado Nonprofit Association, and it's a 3-part session. So I'm just trying to learn more about that role.
And she's doing the Colorado Gives, which will be on Tuesday, December 6th. So it's all the stuff that we have to do to make sure that our agency's in compliance with that. So basically she's doing all of that stuff.
Okay.
And more.
Thank you.
Graham, have you ever heard of other duties as assigned?
I sure have.
That's how the
Yeah.
city of Longmont got over everything, because I worked there for 27.5 years. So
Yeah.
we kind of call on Riley when we're not quite sure and everybody's so busy. We call on Riley to do a lot of the stuff that other folks in the office don't have time for.
Well, that's awesome. That's probably a lot of work. Yeah.
Yeah.
It is.
Thank you.
So I have a few questions too, and Becky, you probably be the best person to start off with.
I'll try.
Yeah, no, so just let me caveat by saying, so board and staff receive the same application, but our board members read it for different through a different lens. They look at your programs, they look at your outcomes, your best practices, etc. What they've been asking about. My job is to look at a couple of things. I look at your strategic plans, at your board governance. By the way, I want to commend you. Very diverse board. Love to see that. So want to commend you on that. But then I look at your finances. I know you don't do an audit. You do a financial review, which is totally fine. Totally fine. So I had 2 questions about your strategic piece and then your finance piece. Okay. So let me start with the strategic piece. Okay. When I read your application, you do share some high level strategic, program objectives around your ESL classes, et cetera, and other stuff. Love to know if the board has any other strategic plans like board development, or it sounds like you're talking about donor development, any other things. I know that you've also been talking about a new building and stuff like that. Love to hear any other things the board is considering.
Well, it's interesting that you'd say that, because we are planning our most current strategic planning session with SVP in December. Okay. We're going to sit down and work on that. We're going to do one day. We know we probably won't get through everything, so we'll probably have to do another day. We're looking at fundraising outside of grant resources. That's one of the things we're looking at. We want to have a more filled out and more techno savvy donor pool, donor information. We want to be able to pull up our donor information off a program. So we're talking about looking at a couple of those. We have not done a whole lot of board development, but that's something we're going to talk about with SVP, because we consider ourselves a working board. We try to attend almost every event that El Comité is represented at. We were at Dia de los Muertos. The board was there, members of the board. We were at Cinco de Mayo. We will be this Saturday at our vaccination clinic and health fair here in the parking lot. And so we're looking at strengthening some of those. We, of course, still get a little confused about some of the financials and why, because I worked in an accounting office. I know sometimes you put it in and sometimes you take it out, but those negatives throw some of our board members. So we're going to do some more planning around reading financial statements and making sure that when we accept our financials, that we know exactly what we're looking at. I think Some of us do, but not all of us do.
And I can add a couple of things. We got our financial review. I can send it to you, Aliberto, if you want it.
That'd be great.
We just got that. We just filed our 990. The other thing is, hold on one second.
She's writing herself a note so she'll remember to send it to you.
I'm
No
getting old,
worries.
I forget. And so part of it is we got funding from the Latino Coalition of Colorado. It's called the LC Latino
I can't remember the
The
whole. all the
Latino
initials.
Community
Foundation.
Is it the
Latino
community?
Community Foundation.
Yeah,
yes,
yeah,
of
I know
Colorado.
them. Yep.
Anyway, so they gave us money to do board, like Becky said, board training more than just our, so not only will it be our review, but we've already done a training on diversity kind of stuff. So it's an ongoing training with different stuff. So yeah, so it's gonna take us a whole year. We haven't, maybe we got the money, I don't know. Yeah, we did, because I just put it in the bank last Friday. And so we got the money, so now we can start hiring people. And like I say, we did the SVP folks. And so, yeah, it's gonna be a training that's gonna keep going, and it may not be every month training, but every other month, every quarter, whatever we feel like we need. Yeah.
Well, and the thing is, I think Becky, you answered my next question. I'm gonna ask the question, but
Sure.
I think you did already answer it in your answer. So the other piece that I noticed, and you're not the only agency, and I've asked this question too. Whenever I see this, I always ask agencies. When I look at your revenue diversity, right? More than about 50% of your income or your revenues come from, as you were saying,
Yes.
foundations and grants
Yes.
but I heard you say, I heard you answer it saying that you all are going to be working on using a digital method to track and recruit
Yes.
new donors, which I think is great. Then the last question I have is, I know it looked like you had some really good year in 2020, and looking at your financial review, had a really good year in 2020. You had a little bit of a loss in 2019 and a small loss in 2021. None of them were huge losses, but I'm just wondering about your reserves and where you feel that is, and what you're working on there.
Well, we're trying to get at 3 months of reserves, which would be probably close to 60,000, and we're probably closer to 50.
Okay.
We do have probably some money we could put over. The other thing that we're really starting to work on is a capital campaign for our new building. So I
awesome.
wrote a grant to oh, I know what happened. Okay, Bridie was just reminding me. The reason 19 and was it 20 or 20?
I think it was
2021.
Yes.
What happened is the county asked us to get this weird insurance that none of my staff, we're not therapists, we're not counselors, we're case managers. And it took us literally a whole year working with them about this insurance. So the money that we should have got in 20, we actually got it in 21.
So
21
And got it in 2022.
Oh, that's
backwards.
why I was a little bit low. That's why you
Yes,
have
yes.
and
So
that's fine. I noticed that. Just wanted to ask. Okay.
And it was like 62,000, and that's why it looks like we have a lot of money. But we're very frugal, and we just had our financial review with, so I have a bookkeeper on site, and then we use Ellis Bookkeeping in town, who's like our accountant. And then we use Middle Mist and Crouch to do our audit. And so it's kind of, that's our, and then of course, Trudy is the treasurer. So her and I meet once a month. We go over the stuff, and then we take it to the board, and then they can ask any questions. And so we have a lot of checks and balances with what we're doing.
Yeah.
And so at our fundraiser, and we're still getting monies, and like Riley said, we just opened an account for like $3,100. Don't quote me on that, but pretty close, at the High Country Bank. And we're really going to start working on a capital campaign. And then I applied for a grant. It's kind of through the Latino Coalition, but it came through Denver Metro, and it's funds that go to Latino agencies that are led by Latino executive directors. And we just got approved. So now we have 60,000 that we'll be able to put into our capital campaign that will help us with the down payment. And so, and we'll be meeting with I've got appointments, 2 different, well, not real appointments, but they know I'm going to be calling them, 2 different banks to find out how we can get that monies from them so we can buy a building and then we can apply for, it's kind of like the cart before the horse kind of thing. We can apply for worthy cause
Right.
and they pay excuse me, up to 50% of what we buy the building for. And then our plan is, we had written some letters to, and hope I'm not lying to, it was like the Gates Foundation, and they said, absolutely, we would love to help you with the building. And so we have a lot of people, Carlos from the Latino Foundation says he will help us with whatever we need to do. And so it's kind of building momentum now. So it's something we've been
Awesome.
working with. And, you know, you all, Kimberly, Graham, and Catherine, you're welcome to come to our office. We're like in 1,000 square feet, and there's like 6 of us.
We're like sardines.
Yeah, we don't have a lot of, so for confidentiality, you know, staff has to step away from their desk to give the case managers that time. One of my
Right.
case managers has a closed door. So that's kind of the stuff. I hope that answered your question. I kind of.
Yeah, no, it does. I just want, yeah,
Okay.
I wanted to ask about, you know, like I said, I look at your financials and I saw that
Yes.
2020 was
Yeah.
good, but 2021 and 2019 were,
Yeah.
so, all right, our time is up. I want to
Okay.
thank you all for being here
Thank you.
tonight and answering our questions, and I hope you guys have a great rest of your night.
Hey, thanks,
Thank you
guys.
very
You.
much.
And
Thank
really,
you.
I'm serious. Come and visit
Yeah.
our building and you can see kind of, we've got real creative with storage and everything else. And we're actually seeing, just an FYI too, we're seeing, we used to see about 130 clients was a lot. We're seeing more like close to 200 a month. And of
Wow.
those, probably 190 are not duplicated. So if they come today and then they come on Friday, they still get counted once. But if they come on the beginning of the month and then at the end of the month with 2 different issues, they get counted as 2. And of that, probably 50% of them are new to El Comité.
Wow.
So the need is still there. We're getting a lot of immigration stuff going on. We do the licencia marcada, and I can go on and on, but you can always call me if you have any questions. I'd be happy to answer them.
Thank you, Donna. Have a great night.
Bye,
Thank
guys.
you.
Thank you.
Bye.
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 Okay. Adios.
There we go. All right.
Next group is in the waiting room if you're ready.
Yeah, we are doing good on time. Let's keep going. This is Intercambio, right?
It is.
Oh, I'm looking forward to meet John, actually. Good evening. Hey, Norma. You gotta fix your camera. Gotta move your, or yeah. Good afternoon. Hi, Erica, John. Very nice to meet you. Love to meet you in person one of these days. Let me introduce myself and do some housekeeping, and then we will get started with this process. So my name is Eliberto Mendoza. We are the Housing and Human Services Advisory Board. I am a staff member for the City of Longmont. This meeting is technically a public hearing, thus it is being recorded and will be available at the City of Longmont YouTube channel at some point. Present with us, we have Graham, who is our vice chair of the board. Kimberly and Catherine are all board members. You will all have a 15-minute window where we will ask questions, and if there is time at the end of those 15 minutes, we will turn it over to you so you can share whatever you'd like to share with us. Before I start the timer, I will give you all some time to introduce yourselves to the board, and then we will get started with Q&A. It will go by fast, trust me. So, all right, why don't you guys go ahead and introduce yourselves, and then I'll get us started.
I have a quick question. Is Francis Zavala with you as well? Nope.
Okay, so you might be with the next group. All right, that's fine.
Okay, I will kick things off. Good afternoon, everyone. My name is John Lopez. I'm the CEO of Intercambio. And I'll pass it off to Norma.
Hi, nice to see you. And my name is Norma Fuentes, and I am the program director of the Boulder County. Erica?
And I'm Erica Carlson. Thanks. I'm the grants and evaluation manager. Nice to meet you.
All right, thank you so much. So we're gonna go ahead and start. I'm gonna start the timer, and like if the board has any questions they want to start off with, go ahead, Kimberly.
Thank you so much for being here. Your application was very impressive, so I really don't have any questions about that, but I do get your emails, and I saw the recent multiple changes that it looks like in leadership, and I'm just wondering how well the agency's doing with the transitions and kind of that institutional knowledge. How is that going forward?
Thank you, Kimberly. This is John, and I'll be happy to answer that question. And my colleagues are welcome to chime in from their perspective. So this is day 11 on the job for me. And so, as you might imagine, having had one founder for so many years and Intercambio, there's a lot for me to catch up on. But let me share just a couple of minutes here with my background. I was born in Belize, and so I immigrated here as a child. And so I'm somewhat familiar with the journey and some of the assimilation and integration challenges that come with learning a new language and a new culture. And so it just seemed natural for me at this point in my career. I've worked in large companies, for-profit, not-for-profit, I mean, you name it. I've worked at various different types of organizations in different roles. I wrote a book about an immigrant's journey to the C-suite. And so I've often been on diversity committees and things of that nature. And at this time, it was just a great time to join Intercambio as we embark on this next stage. In terms of getting to your question directly, as you know, we have several longtime employees, Norma being one of them. Norma's been there over 10 years and herself has gone through all phases of our services and programs. And Eric has been there several years putting our grants together. There are several other staff members who I've spent focused time with, just getting the history, the current situation. I've read some plans. I also had lunch with the founder, and he and I have committed to having weekly calls and staying in touch, because I want to honor what Intercambio has been in the past and help set the direction for the future. And I recognize that requires capitalizing and leveraging the institutional knowledge that's been available. I've also met with many board members who have been involved with Intercambio for many, many years. So we have a series of meetings with board members from a more private setting and house parties, so to speak, just to get out of the office and get to know them and share some of those stories that will be helpful as we try to lay out a framework for moving ahead. So that's probably a mouthful for what could have been a simple question, but I thought it was relevant given the changes.
Thank you so much. That was very helpful.
Yeah, we definitely have a lot of longevity here. So board member, one of our chair of our development committee right now was the person who hired me. She was working as assistant director at the time, Christy Spear-Smith, and now she's chairing our development committee. We have that kind of longevity here, and so John is going to be here to help us with a lot of transition and changes and growing our program. But we're really, we have people like Norma. We know we're comfortable moving forward, I guess. Yeah.
Yes, I just added, we are, the last 2 years we have been so many changes, we all, and Intercambio is, internally tremendous changes. We are very excited and happy for the new journey that we are facing, and we are very, very happy embracing the new leadership and moving forward, connecting communities and supporting our immigrant community to even be stronger than ever.
So I had a question in terms of measuring outcomes. So the grant application is for, Longmont's priority of economic stability, mobility, and resilience. And I see you're anticipating or hoping as a 2-year long-term goal that there will be a 40% increase in employment situation for folks who go through your program. Is that based on historical data, or is that just an anticipation, or where's that number coming from?
Yeah, so that came from some surveys that we did now embarrassing to say how long it was ago because of the COVID situation. We said we we're going to do it every 3 years. And then of course, I think that was in 2018 and so, or 2016 maybe. But basically, you know, we've done surveys with our students and interviews where we can discuss deeply kind of how their situation has changed because of COVID. We do also ask just what's your income, but it's a little spotty data because it's hard to quantify what people's incomes are when they're not kind of, you know, filing their taxes in the standard way we might expect, right? It's going to be like, oh, I'm working this many hours here and this many hours there, and trying to gauge that. But that is something we do ask in our follow-up deeper interviews that we do. And we did see about 38% at that time when we did it, that we found 38% of our students, and we've interviewed about 350 students that have been with us for more than 2 years. And we saw, you know, that's how many had really had an increase either in income or in finding a new job. So that was it's real data.
Okay.
Yeah.
Okay. And do you measure like how much the income is improved, or do you just ask, has it been improved?
I mean, we did ask at that time.
Mm-hmm.
Like I said, it's real. We've been experimenting with different ways to ask about income. When we ask about an hourly salary, some people are working per job, some people are working per month, different things. And so it's been hard to really track that in a way that we can really see the changes. What we really are seeing the changes in is when we ask people, tell us how your income has changed. So in those deeper interviews. And then when we did see that, the people who shared that they had increased their income, we saw an increase of about $4 an hour, which was pretty impressive considering most of the people were starting at a fairly low salary. So this is something we want to improve, we want to do better at, and we're you know, working on new ways to learn that. Right now we're asking people about their salary range so we can get a better sense of like how people are moving up kind of from different levels, but it's not the tell us exactly how much you make per hour. Because if I ask Eliberto and I ask Kimberly and I get monthly, hourly, annually, you know, we can't, it's hard to align it all. But
For sure. Okay, thank you.
Doing better. Thank you.
Mm-hmm.
So I'm going to caveat these questions because you know, the board and staff see the exact same application, but we look at different things, you know. So whereas Graham is looking at your outcomes, it's not that I don't look at them, but that is not in the purview of my evaluation. I don't evaluate your outcomes. Of course, I look at them and am totally interested in them as well. My purview is a couple of things. One is, you know, your governance, your strategic planning process, your collaboration piece, and then the other is really your financial position and how sound you are as an agency. First thing I'm going to say is, as an agency, you pretty well sound financially speaking. You have, you know, your average, you're around 4 months of reserves. That's great. I love how diverse your funding is. When I did the math, it's almost thirds, right? Where you got government, foundation, and of course your social enterprise work with your with all the partnerships throughout the country you all have. So that's, I had no questions about that. That all really well done. Really, my only question, and it might be just more just you know, given the amount of space in the grant type of piece, and it also could be a piece of John is new, and so maybe this is the next step. But what I'd love to hear is, I saw some, you know, higher programmatic level goals around increasing students and all that stuff. And what I'd love to hear is something around agency level, either governance or, I mean, not that you're doing great right now in your funding, but whatever Christy's talking about at the head of as the head of development, I'd love to hear any of that level of strategic goals from the agency. Maybe it's too soon, maybe John is taking a look at them, but I just like to know if you have anything, or if you're planning to look at them again.
Yeah, I'll talk about that. Obviously, in the early stages, we've had quite a bit of interaction with the board, and we've talked about, as we move into this next era, what are the organizational goals in terms of growth. And so we're still kind of evaluating what exactly that will look like and what it means, but certainly expanding our presence where we already are. We are, you know, Norma has built a tremendous team. So growth might be just offering more classes, the pace of classes, maybe changing locations depending on where the demand is. So definitely when we talk about growth, it's expanding essentially our social impact, not only in Boulder County, but potentially obviously in the Longmont area and where we already have a nexus of support. There's also the conversation about getting in front of a more national audience in the sense of ESL and ESOL getting a lot of attention. And so we want to go to conferences and be current in the field so we can stay on top of what might be the next iteration or what can we learn outside of Boulder County that we can bring back here and deepen or expand the services and programs that we provide. So from a planning standpoint, it's mostly growth related, but certainly starting here and then it's expanding out as resources and demand allows. And so we're kind of defining what that is. Erica might have some more to add to that, but Alberto, does that give you a little bit of a—
Yeah, of course. I totally understand the transition and looking at the future and all that. And you brought up a point that I have a question if Erica doesn't have anything to add, actually. Okay, so your point about where the growth is, this is not necessarily part of this application, but would love to get your Norma's perspective as we see housing costs rise in Longmont. And we understand that immigrants, many times, not always, we do have some immigrants that come on certain visas. They come for high level positions and they can afford to live here. But I can imagine that many of the immigrants that you work with, Norma, are people who are not, at that higher income level. What are your experiences? Are you seeing any migration out of Longmont? Are you seeing what are you seeing there?
Well, I don't have the data right now, but we do have the data that a lot of newcomers, a lot of new immigrants have been enrolling into the English classes. That's
Okay.
what I have seen, a lot of new immigration. And, as you can see, we are just getting back to the normal after
Right.
all those 3 years. We are doing everything slow, depends on the demand as Jan mentioned, and moving forward with the demand and with the trends is coming and trying to support them. But we have seen a lot of new immigrants in the community.
So I think just on that same vein, are you seeing more growth in Longmont than Boulder, or is it kind of equal?
It is unfair to answer yes or no, Boulder or Longmont, because we have been open the classes more in Longmont than Boulder. In Boulder, we just open 4 group of classes, this term. I can say that classes are full. It's hard to say that. I can tell you that we have 272 students active right now locally taking English classes, and 52% of them are from Longmont.
Okay, good. Just wondering. All right. And then my last question is, the other piece I look at is level of collaboration. And I know that Intercambio collaborates with a whole bunch of folks. I'd love to know, we just had Open Door apply. And I'd love to know, what other partnerships you have here in Longmont. I know, I'm sure you have a whole bunch, but you'd love to just rattle off list a few, that would be great.
Well, collaboration and partnership has been looked differently.
Okay.
We just starting getting back. We are partnered with Open Doors, with reference students back and forth. They fit in our program or they fit in their program. We mail. I can tell you that we have few months, working at that office. I haven't met with all our partners, like in person. I have been having visitors like in between camp that we can see how can we collaborating. It's rebuilding again the community, but we have a long-term relationship. Very strong relationship, but and still working on it, but kind of different way. I haven't been able to get back with a Front Range Community College and have those field trips that we used to have, but I'm still working on it. Everyone has been busy and trying to, to have an set of programs, but we are here to support each other.
Awesome. So board, we got about 40 some minutes, if we have 40 some seconds. I'm not sure if anybody has any more questions. If not, we'll turn it over to Intercambio to finish out. All right, John, Norma, Erica, whoever wants to close us out tonight.
I'll be happy to do so. Just want to first thank you for your time, giving us the opportunity to continue to work with other partners in the local area to just serve our students. We're here for them. They need our assistance. We're here available all the time. And the more support we can get locally from entities and organizations and individuals like yourselves, the greater the impact we can have for our immigrants. I got to tell you, I had the good fortune of being there for the first night of classes last Tuesday. And it's just such a vibrant, invigorating, rewarding thing to see them come in, you know, with snacks after work, coming, just trying to figure out how to integrate, learn the language, and improve their lives. And it's hard to not be committed to such a cause. So every chance we get to have an audience such as you who can help us create that social impact is just much appreciated.
All right. Our time is up. Thank you very much for being here tonight. I hope you have a great rest of your night. Appreciate all the work you do here in Longmont.
Thank you so much for your support as always. Thank you.
Bye. All right, we are doing good on time. I forgot to mention their board has over 43% of their board is people of color. That's pretty good work from where they started years ago. All right, I think our next is Mile High United Way. Not sure if they're around. Oh, here we go. Hey, Lisa.
Hey, how are you?
Good. Are we waiting on Rosemary and
Yes,
Gina?
indeed. Yep. Yep. Rosemary and Gina should join us any minute now.
Okay, awesome.
I can send them a quick Teams to just let them know that it's happening.
I think we're just doing really good on time. We don't always do this good on time, but we've been pretty disciplined about the 15 minutes, and just so that's why we're a couple of minutes early.
I think we also have a new employee at Boulder, Cap, who's starting, who's our PI partner as well.
Okay.
So I've just teased everyone and just say, come on, folks.
Okay.
Sorry for the wait.
No worries. No, we're a little early. That's fine. Like I said, we've been pretty good on time tonight, so. Are they having issues getting online or anything?
I'm not getting messages back, but I just noticed there was somebody starting a Teams meeting.
Oh, here comes Rosemary.
Okay, good. She's our main person, so I'm happy to see her.
Here's Gina. Okay, so we're getting everybody. All right. Can you all hear Rosemary and Gina, can you hear me?
Yes. Hi, Alberto.
Hey Gina. Hey Rosemary.
Hello. Yes, I can hear you.
Are we expecting the new staff person from CAP as well?
Yes, I believe she was going to be joining us.
Okay. That is awesome. As she comes online, let me first introduce our board members and then I'll go over some housekeeping. Hopefully she joins us here soon. So our board members tonight is Graham, who is our vice chair. Kimberly and Catherine are both board members. What I haven't told the few agencies before is typically you're used to seeing our entire board. And this year, what we decided to do was a little different. We decided to allow board members to choose their priority areas that they were most interested in. So this is you all fall under the self-sufficiency and resilience priority area. So these are the board members that chose to review and evaluate these applications. That's why you don't see all 7 board members tonight. So let me just a little bit of housekeeping. As you know, this is a public hearing. The public is invited. We didn't have any public tonight, but it is being recorded, and because we post these, and it will be hopefully available on our City of Longmont YouTube channel at some point. And so we're gonna have 15 minutes. I'm gonna let you all introduce yourselves. And as soon as that's done, I will start the timer and we'll have 50 minutes of Q&A. And then we will, if there is time left over at those 50 minutes and we're done with questions, we will turn it over to you all for anything else you'd like to share. Yes, Brenda?
Is Francis Zavala the person you were waiting for?
Okay. There we go. So we can let her in. Make sure she can hear us. Can you hear us, Francis?
Yes, I can.
All right. Welcome, welcome, welcome. You're the new person from CAP. We're gonna go ahead and get started with 15 minutes of Q&A. Just so you know, Francis, this is a public meeting and it is being recorded and will be on the City of Longmont YouTube channel. Just I want to make sure that you're aware of that. All right, I'm gonna go ahead and start the timer and we're gonna get going. If I can get to this thing on, there we go. And go. Not sure if our board members want to start with a question.
Sure,
go ahead, Graham.
Start with a question. I'm just trying to resolve in my head some of the data here. So maybe I'll just say what I'm seeing and y'all can correct me if I'm wrong, but it looks like first half of 2022, you served 24 folks in the City of Longmont. You're asking for $30,000 to serve 6 people in 2023. Is that right?
Yes, probably the numbers that you're seeing there in terms of the number of people that we serve. We like to give you the full picture in terms of the people that we are serving within the City of Longmont. So the 24 wasn't supported entirely by the grant that we had received from the City of Longmont, but that includes other funds as well that we have received.
Okay, and do you find that folks who would utilize your services are they in greater need of sort of education around finances, or are they in greater need of the match of the finances?
We hear that they're in need of both, I would say. it's really helpful for a lot of PI participants, for someone to be there to help guide them onto the next step, and for them to understand what it will take for them to achieve their asset goal, whether it be home ownership, business, or education. But that education is really key in helping them take that next step in building their plan towards purchasing their asset, whether it be home ownership or a business plan. So that's really key. But the funds are also really key, because we're seeing, especially at this time with the way prices are, that's also really key to helping people get into purchasing a home or starting their business or going to college.
Okay. And one final question. What do you think the main reason for fallout is for, in terms of the people who come into an orientation and don't make it to an asset acquisition? Do you track that conversion rate? And can you tell me sort of what the main reason is that someone might not go ahead all the way through to an asset acquisition?
But really, when they come into the program, when they come to an orientation, they might not have an understanding of what it might take for them to, pursue the PI program in terms of the amount of time it will take. They're required to save for at least 6 months in the program. That's really to help them develop that savings habit. It might be that they don't think that they want to wait that long. It might be that they get intimidated with the paperwork. I'm not quite sure. We haven't gone back to ask people why they haven't completed that. But it might be that it's just not the right time for them, and that hopefully they'll find the resources that they need, and either come back to the PI program in the future, or they're able to take a different route for accomplishing their goals.
Okay, thank you. Thank you all for your hard work.
Thank you.
So, I always caveat these questions that, the board and staff look at the exact same evaluation, but have very different questions or points of evaluation that we have. Where the board is looking a lot at your programmatic goals, your outreach efforts, how you connect with folks, and all of those kinds of pieces. My role is primarily looking at your strategic piece, your collaboration pieces, your board governance, and of course, the DEI work that the board is doing is very important to our board as well. And then also look at your financials. I'd love to know, Rosemary, I think I know, but I'd love to know when I look at your application, and in particular that first question around, your goals and your unique services. Love to know who some of your partners are in Longmont that help you attract or work with folks that could really use PI here. Who do you work with here to achieve your goals?
Right. So some of our key partners in the past have been our center, and they are one of our partner agencies and referral agencies. We work with Front Range Community College, and we've been present there at different outreach events that they have had. We're also well connected with the In-Between. We've had specific meetings there for clients or participants and their programming on site. So whether it be individuals that work at these organizations or individuals that are attending what these organizations have to offer. We offer the program throughout the area, and those are some of our key partners.
Awesome. I mean, your financials look great. You're a big organization. Your campaign, I don't have a ton of history, but when I look at your campaign, it looked like it with a little context, I know it looked like it's doing really well. I could be wrong, but from what the numbers I saw, they look great. I guess the question I have around your financials is, totally heard about that gigantic, wonderful gift that you all received, and just wondering, I mean, this is just wondering and throwing it out there, is any of that being going to be used to support or increase the work that PI is doing in Boulder County? And maybe, you know, when I was at CAP, I knew that, you know, we were kind of one of the few, if not the only one left in the state doing the IDAs. I know Pikes Peak had been doing them for a while, but, you know, just any thoughts on expansion?
I'll chime in. Hi, everybody. I'm Gina Nacera. I'm the Vice President of Community Impact at Mile High United Way, and I work closely with several of our Community Impact Division programs, PI being one of them. So in terms of the Mackenzie Scott dollars, Lisa, I know you write about this a lot in grants. I would say that a lot of it has been allocated already.
Okay.
And in terms of some key partnerships that we have with organizations that are committed to building out community hubs, including ECE centers, and these are organizations like Warren Village, Mercy Housing, the Family Tree, I know I'm forgetting one, Lifespan Local. So between those 4 partnerships, that is $2.5–3 million, Lisa. We've committed millions of dollars to our strategic grants. We're in the middle of our $7 million 2-year cycle for strategic investment grants, and over 100 of those, or not over 100, we have over 100 grantees in 7 counties, and a large portion of those, probably a quarter or more, are from Boulder County and Broomfield County. And then we also bought a building with the money. We bought Penn Street Apartments, and a lot of our Bridging the Gap young adults who have aged out of children services are now accessing these apartments. They're right on Capitol Hill. They're beautifully renovated, and we are utilizing them for not only our program clients, but also for other partners who I think we have a few people who just moved in who have refugee status. So it's that was a $5 million building. So we are really putting that money to very good use. In terms of expansion, yes, that is our goal. Rosemary is working very hard on this. We would love to have the program potentially expand to other counties within our 7-county footprint. We are Denver Metro. The major 7 counties. We're looking at Adams County. We're looking at expanding a little bit more in Broomfield if possible. And we're looking at potentially bringing it into some of our internal programs to support the clients that our other programs are supporting already, like the young families in our United for Families program, which is birth to 5 years old. We have to raise more money. We just do. Will we utilize some of the Mackenzie Scott dollars for PI? Possibly, especially with those relationships that we're forming with the 4 organizations I mentioned in the beginning. As they bring in our own programs to support their clientele, there may be the opportunity to bring in PI and utilize some of the Mackenzie Scott money there. It's just still all developing, but we have utilized a lot of it already, Alberto.
Okay, well, that's good to hear. Yeah, because I know, you know, we've had this conversation, you know, in particular around on the housing side of it, Rosemary. As you know, I think you've increased the amount, right? Because the reality is that, you know, what was provided before is just struggling to be enough for the need that's out there. And so that's why I was wondering about that. With that being said, how is, I guess I'm stepping a little bit of bounds and going into the program piece, where it's really the board's piece. But let me ask this question: how is what are the biggest challenging, understanding that the higher cost? How are you coping with that? And how has that increase helped, or is it still just a huge challenge?
I think it is a huge challenge for many people. And what we've done with that pilot funds that we set aside, we had 2 slots that we set aside at that higher savings amount. And we had one PI participant that was going to, not continue pursuing their home ownership goal. But because of the funds that were provided with this pilot, we were able to offer them that additional savings opportunity, and they stayed in the program, and they're still looking for that affordable home. And so I think that we're trying to really focus on people that are not, perhaps maybe they don't qualify for other affordable housing assistance, so that we're really focusing those funds on those that need it. But we do see that there are some other funds that are new this within the last year or so to help people, especially people of color, with purchasing homes. So we're really promoting that, if it's not internally, externally, to pair their $5,000 with additional funds. So we're seeing that people are continuing to do that, but we know that is a challenge. I think that for some people, health is still a challenge. We're seeing that people have changed from home ownership to business or to education. So we've seen some people decide that, it's really not the right time for me to be continuing with my goal with PI. So we've seen a little bit of shift, and Gina, I don't know if you have others.
Well, but that actually brought up an interesting point, Rosemary, only because I just heard about it or read it in the Longmont Leader, and going back to the partnership piece, is if you're seeing more increase in business, I know traditionally PI has worked with SBDC and Jesse and all, and that's been great. Any outreach to E for All in the work that they're doing?
I believe that we have had conversations in the past about E for All. We don't have a formal partnership with them.
Okay, just wondering, because I know they're growing too in their entrepreneur work. So
yeah, Alberto, we have met with them a couple times, but I haven't met with their newer ED.
Okay.
I met with their first ED in Longmont, so it's probably time for us to just do a call and get together and see where the synergies lie now, as they've been in Longmont for a couple years now. And I do want to say, just for the full context for the board, and you may already know this from the application, but we did, Alberto and Cap agreed to allow us to take some of those Longmont funds and our 4-to-1 match to increase it, that if a participant in Longmont was able to save $2,000, that they would then unlock $8,000, still 4-to-1 match. And Rosemary and, at the time, Diane, now Francis, were really thoughtful about that, to look at those participants who probably weren't going to qualify for a lot of additional subsidies. Many of our homeowner participants or home asset participants are really looking for subsidized affordable housing, because many of them qualify. So Rosemary and Diane, now Francis, again, were very thoughtful, like, where are there some Longmont participants who could really save because they're not going to be able to access as much subsidy. And happy to say that both the slots that were opened up last year are currently being utilized, and they're in the process of saving. Are they both for homeownership, Rosemary?
Yes.
So our timer has gone off. I want to thank you all for your time tonight. Appreciate nice seeing and meeting you, Francis. Yeah, thank you so much for your evening, for your time tonight, and thank you for all you do for Longmont.
Thank you.
Thank you all.
Thank you.
We appreciate you all. Thanks.
Have a good night.
You too. Bye-bye.
So we fell a little behind on that one. It is 5:40. is our next group here. And the next group should be out Boulder County. They're a new group. So,
Yes. Marty's here.
okay, good. Yeah, this is a new group to us. Hey, Marty. You are on mute, but you can hear us. It sounds like that's good.
Yeah. Hi, Alberto.
All right. Thank you for joining us tonight. I'm gonna introduce our board and go over some housekeeping, and then let you introduce yourself. This is your first. Well, it's gonna be your first time applying, but this is the first time for this board.
Yes.
I'll talk a little bit about that. So first, let me introduce our board. We have Graham, who is our vice chair, Kimberly, who's a board member, and Catherine's a board member. Just some housekeeping. As you know, this is a public hearing. So it is being recorded. It will be at our City of Longmont YouTube channel at some point. You know, typically all of our board members read all the applications, and usually it's a much bigger group, but this year we decided to allow board members to choose the priority areas. I have to give a little caveat. Marty, I wasn't sure where to put yours because you do both mental health and case management. And so I kind of put you in the self-sufficiency, but you could have been in the physical and mental health piece. So the board may have a little bit of questions about your program and what exactly you're going to do. I kind of struggled and went self-sufficiency, but we could have a conversation about that. So you're going to have 15 minutes of Q&A. But before we do that, I'll let you introduce yourself.
Thank you. Hi, everyone. My name is Marty Moore, and I am the Executive Director of Out Boulder County. I've been in my role for 9 years, 1 week and 2 days, something pretty close to that. And I started with brown hair. And I am very glad to be here. In my 9 years, this is only the second time that I've been in front of the City of Longmont for possible funding. And so I appreciate being here more than you probably know. And so on that, if you have any questions about me, I'm always happy to answer she, her, my gender pronouns.
All right, let's go ahead and get started with the timer. Go ahead, Graham.
Well, that's the first one. Thanks for being here, Marty, and I appreciate all your hard work. So you're applying for $10,000, and I see your program activity. It's a lot of activity. I think you had 4 really big rocks, if you will. Like I could see each one of those chewing up $10,000. And I guess I'm most curious about your looking for a training organization to help. And how's that search going? Do you have specific training organizations in mind, and what will they train to? And then this, maybe the former issue you could speak to is just like what exactly will the money go to with all of these programs you have in mind?
Well, so we asked for 10,000 because we've never gotten any money from the City of Longmont other than LMAC. So we could have asked you for 100,000, and then we would have thought we didn't get it because we asked for 100,000. So we thought we could start small and show you what we can deliver and go from there. We also received money from the City of Boulder and the county that is along similar lines. So there's some cost sharing amongst you all. The county has really carried the load for Longmont over the time that I have been here. So Alberto, I appreciate your comment about where we fit, because we do so much. And to Graham's point, the $10,000, I think that, you know, when I sat down and looked at this, and Tamora and Bruce put it together, and I just get to be the one to appear, that we serve a lot of people from Longmont, a lot of folks from Longmont. And being in the self-sufficiency piece of the City of Longmont, there's a lot of homeless trans women in Longmont, a lot. And through, like, I've been the case manager. I'm so excited we got ARPA money, that we're actually going to get a case manager soon. But we have done a ton of case management. Sorry, I had to be 2 places at once. We have done a lot of case management over my tenure with City of Longmont. we are working. So one of the things about our organization is we always try to be better, and we know when we make a mistake, and then we find some people to help us. And so one of the things, and our staff, I don't know the numbers, but we're about 40% at least folks of color on our staff and on our board. But having the numbers isn't enough. Like, what does it look like to really be an inclusive organization and in those intersections? And so we have identified a group called Point B that we are in conversations with around that piece of the work. And that'll be more like $10,000, right? You all would provide a piece of that. When we talk about the events, I mean, Ruby Lopez, who runs our People of Color programming, is doing a bang up job. They haven't quite been here a year. And those numbers aren't out of reach for us at all in the variety of different things we do, whether that be the dancing that's happening on Sunday nights at the center, which is like open to everybody, but I haven't gone yet because I have to maintain some respect. I don't have the moves. Like we did a Cutie Park camping trip this year. It's, you know, people get to get outside, do some healing, and build community. And so, you know, it's one step after another. So there is bringing community together, everybody from, you know, Ray Rodriguez and folks who are in the professional world to folks who are living on the street that we're serving, who are residents of Longmont. And I hope I got to your questions, Graham.
Yeah, I would say though, and I apologize. I mean, I read the application, but I would say as we look at your contract, if you do get chosen for funding, Marty, I think we would have to be very thoughtful about because I'm not sure if we could help cover the cost for the training. Some of your like the work that you're doing around social healing and all that kind of stuff does, you know, that would probably be able to be fine. But just want to be thoughtful about that.
I appreciate that. And I don't think I answered the question, but I don't think specifically we put that piece into our budget.
Okay, good.
Yeah. So, you know, what we have in our budget is a little bit of money for Ruby, $5,000. And our staff all starting wage is $52,000 a year with full benefits. The board made that investment. And so we are staying within livable wage in Boulder County. And they don't make any contributions to any of their health insurance, and we have a retirement plan. So we're asking for $5,000 towards that. We're asking for $2,000 of general operating support from the city of Longmont, which is like taking the calls. You know, the phones ring off the hook, people walk in the door. We have a lot of that. And
So
then
like information and referral type of support, is that what you're saying?
So much. Thank you for that.
Yeah, because that is the way we're going to want it because we also don't, I mean, technically we don't do general operating, but we do information and referral.
That's exactly what it is. I mean,
that's
yes.
fine.
Yep.
Okay. Yeah. So this is your second time you want to explain something. Yeah. We can fund INR because we do it for other agencies. We typically don't fund just general operating, but INR is totally a legit piece and the self-sufficiency piece.
And that's the key, you know, to our work is people don't trust mainstream systems. And we found that with our vaccine work, right? They weren't going to go get vaccinated unless they trusted us, we trusted public health. And it's the same thing when somebody needs food or when somebody needs clothing in Longmont. Like we train our center staff so people know that they can go there and they'll be respected. So there's a lot of that piece, you know, the restorative justice group, Shalene, you know, all those different pieces, we build the relationships and trust them. And so then our folks will. So there's a lot of that, Alberto.
Awesome. Yeah, just wanted to make sure that we're clear on what we can and can't fund. So, but yeah, we can do INR. That's totally fine. We can do, you know, it sounds like what you're asking for more is more of the mental health piece on this. And that's fine. I wasn't sure where to put your program, whether self-sufficiency or the health piece was. So that's good to get that clarity.
You know, we fit both places because you can't do one without the other, right? If you can get somebody feeling good enough to go to therapy, that's a big hurdle.
Right. So with that in mind, I guess the question I have is, so it sounds like you're training. So let me caveat this piece with saying, the board and staff, we see the exact same application, but we look at different things. Where the board is looking at your program outcomes as to Graham's questions, staff is looking at your finances, looking at your agency structure, your collaborations, ensuring there's not duplication, all of that kind of stuff, your strategic planning. And I guess the question I would have, it sounds like you're working with the Art Center, training them, that collaboration. On the mental health side, what kind of partnerships do you have? Because I think you're right about, people not trusting our mainline systems. What kind of partnerships do you have on the mental health side to ensure that the folks that you're navigating to them are finding a welcome hand at the end of your navigation?
We are working right now with Umbrella Collective. A lot of people are still doing virtual, right? Not everybody, but we have both options. So we'll place somebody within 1 business day of when they reach out into our point system. And we work with Umbrella Collective because they're all LGBT or LGBT affirming, and folks of color. We also we have 2 vendors that we work with. The other is Field Therapy, and Sam is based in Longmont, and works with another therapist who's an Asian non-binary person in Denver. And then we were working with, and I don't know the answer to this, and I'm sure tomorrow has solved it. We have bilingual access, but the one person that I knew, Vivi, who was doing it, is no longer doing it. So I can't tell you the name of that person, but that is through Umbrella Collective. Our program supports people who are income qualified,
right,
but aren't on Medicaid yet, or who are on Medicaid. So that's who we can support to make sure undocumented folks are covered in this, or people who haven't had the energy to go through the government system, and then we'll help them. But we won't wait for the paperwork before we serve them.
Okay, good. Yeah, good. Yeah, I knew it was a pretty broad application. So like, they do mental health, but they also do case management and resource navigation. I think and of course the board has questions. They can always jump in as well. It sounds like, financially speaking, it sounds like you're doing pretty well. I saw your 2021 990 that you shared. That was great. Talk to me about your reserves and what you want to work on that.
So we need to increase our reserves as our budget grows, right? Last year we crested $2 million, which in 9 years is pretty great. Because when I got here, the ship was sinking pretty fast. So we've done that. Our reserves are for a rainy day fund, right? And we haven't had to touch them. Knock on all the wood that I can find, even through the pandemic. We didn't have, there's a couple times where I'm like, I'm glad that's there, but we didn't have to get to it. So the reserves are there. We'll continue to build the reserves in our capital campaign. That's one of the elements of the capital campaign, is to build out that reserve a little more. I'd like to have 6 months operating in there is the end game on that.
Awesome.
I will say in 2022, and I know you've talked to other folks, and I have too, individual giving, it's been a tough year for fundraising because of inflation. Our lower level donor, $25 means a lot, whether it's food or gas or whatever that means. So we initially saw a little dip, but we're headed back up. We may end the year as budgeted in individual giving, but that's yet to be seen. We'll see what happens next with the economy and the election, and there's a lot of variables this year on that. Our other streams of income have been strong, from government contracts with BCPH and the state around tobacco cessation. Colorado Health Foundation just gave us $107,000 this year and $107,000 next year for our youth program. And we received some federal funding this year around safety and hate crimes. So I think we're doing a pretty good job of securing foundation grants. Corporate giving has been up for us this year also, as has churches. Congregations support our work, and that lines up. So the individual giving line is the one I think that's tricky for all of us right now in the nonprofit world.
Okay. I don't know if the board has any other questions.
If I might add one thing,
Of course,
as-
yeah, at this time, yeah, go ahead.
and just around the financial piece of it. So I've been in fundraising a long time, and I've watched a lot of nonprofits fail. And one of the things that can happen is you get all this grant money, and you don't, and then all of a sudden the grantor decides, well, we're not going to fund that anymore, and so that rug is pulled out. And if you don't have the individuals giving you money, it's all going to tip over. So it's really key. I think last year or this year's budget, we had budgeted 42% of our income from individuals, and 50 is really kind of the key. But you have to grow that as the grantors come. So just FYI and looking
Yeah,
at
the old
financials.
three-legged stool, the three-legged stool analogy, right? You want to have some foundation, some government, some, you have at least 3 good sources of revenue. So if there's no, I mean, I actually don't have a ton of questions, because I mean, other than we'll probably have to figure out exactly what we can and can't fund from your application. I think there are some things there that we might have to be more thoughtful about if you do get funded. But that's fine. That's part of the negotiation process if you are selected. But I do want to really quickly this is the first time I've seen your application, and you came in with nearly 40% of your board that are people of color. Not sure if you know this, but that's a huge thing for our board. That's something that we want to see, that we're working on as well, and we know it's a challenge.
It is a challenge, and it's also a challenge not to be tokenizing and doing it right.
Yeah.
And so it's like, oh, we have 60% folks of color, and then you have 40% of the white people running it. And so that's some lessons have been learned along that way to that point. But I'm really proud of those numbers, and I'm really proud of our staff numbers and our volunteer numbers.
All right, and we have about 30 seconds left, Marty, so I'll give you the last word.
Thanks for considering us. It'd mean a lot to receive. I live in Longmont. It'd mean a lot to receive some support from the city of Longmont for the great work my team does.
All right, thank you very much for joining us tonight, and have a great rest of your evening.
Thanks for your volunteer work.
Yeah, like I told Marty, I wasn't sure where to put that application, because he's got a little bit of everything in there. I think that and I'd be fine if the board says they belong in the health, or if you all say she belongs in the self-sufficiency piece.
Where's she most likely to get funded?
Well, I mean, as you know, this is a formulaic process. It's really about scores. I think either way, it doesn't really matter. It's what you score her and what I score her and the other staff person, right? Because it's an average. At the end of the day, and she's not asking for a ton, and most folks aren't asking for a lot. Really, what those priorities mean is how much, how much they meet we have priority limits as the board has chosen. And so it's more about that than what likelihood for funding. The likelihood of funding is much more around what we're doing tonight, the scores that you all provide, the scores that we provide, and we average that. And then that's what determines funding. I'm not too worried about which priority they fit. It was just because I struggled with that one.
Let's keep them with us, because I agree with you, Graham, of their chances for funding.
Yeah. At the end of the day, I think that if you all, whatever, again, it's all about your scores. This is why it's so important that you read the applications and you score as you see fit, how the agency did. We're gonna have to say goodbye to Kimberly for a little bit.
Should I completely jump off? Is that the best way to do it?
I mean, if you want, we'd love to have you back for what's after the Art Center. I think after the Art Center, it's our last agency.
Yeah.
Either way, it's fine. I mean, always love to have board members ask questions,
Yeah.
but because you are a subcontractor for the Art Center, so we're not going to have her scores. It'll just be Catherine and Graham to average your scores for the Art Center. Just kind of to make sure that we sit within that conflict of interest piece.
Definitely. If I turn off my camera and just mute and then come back with the final.
Yeah, that's totally fine.
That's okay. Okay,
Yeah.
I'll do that then.
You can listen in, you just can't participate.
Perfect.
So,
I'll do that.
yeah,
Thank
we've done
you.
that with Brian too in the past, so it's
Okay.
totally fine.
Great. See ya.
Okay. All right. If they are here, Brenda, if the Art Center is here, we can let them in. All right, Mark, your second go around. Mark was here. Typically we hear him at the same time, but this year, because of how we did it, Mark was here for our education piece, and now he's back. So is Elaine for
Hi,
our
Catherine. Good to see you again.
yeah, for our basic needs piece. So Kimberly Strange will not be participating because she's actually a subcontractor for the R Center. So for conflict of interest piece, just to be on the safe side, we've asked her to recuse herself from this session and from scoring your application. So it'll just be Catherine and Graham scoring that application, and we'll take the average of that. Mark, so just so you know, that's why she's not on camera, because we just want to make sure that we're all on the up and up.
Sure, sounds good. Thank you.
All right, so I'm going to introduce Graham and Catherine. Graham is our vice chair. Catherine is one of our board members. Quite a quick housekeeping. You have 15 minutes with question and answers. We are going to go ahead. As you know, this is a public hearing. It's being recorded just like the other one. At some point, it'll be on our City of Longmont YouTube channel. If we go through this time and our questions end before the 15 minutes, you will have an opportunity to share whatever you think is important. I'll let you go ahead, introduce yourself and Elaine, and then we'll get started.
Okay. Hi, my name is Mark Cowan, the Executive Director for the Our Center. And Catherine, it's good to see you again. And Graham, thank you for being here. I said last time I sit on grants committees as well and review them as a community member. So I know the time you guys put into this. So thank you very much for doing that. Elaine, do you want to go ahead and go?
I'm not sure she can unmute herself.
Maybe not.
Oh, here she comes.
Sorry about that. This is Elaine, Development Director of Our Center, and I'll just be listening in for now.
All right, so I'm gonna go ahead and get started, and if board has any questions.
I'll go ahead and start. I noticed that you measure the 5 social determinants of health. Can you tell me where, which in those 5, y'all struggle with the most, and what you might be doing to address that?
Oh, that's a great question. The last 2.5 years, it's generally been a struggle across the board because we've really moved into crisis prevention mode with the pandemic. And so a lot of families, we were processing as many households as we could, as quickly as we could, to keep them housed, make sure they were in a good place, they were stable during, when the community closed down, jobs, families were being furloughed, preschools were closing, classrooms were, so it was quite a time where there was a scramble mode. But I can tell you that as we're coming out of the other side of that, what I would consider maybe the most important, and the one that I think is the most difficult, is housing. There's a very limited stock out there. We don't do housing, we do the prevention of homelessness. So we provide rent assistance. We've had the ability to tap into a lot of federal dollars, which helped tremendously, but those dollars are starting to basically flame out, and they're going to be gone by the end of the year. So we've worked hard to position ourselves going into 2023, knowing that the money wasn't going to be there forever, to continue to be able to support as much as we can, as long as we can. But housing is so expensive. There's so many people that are struggling with housing right now in our community. And we're seeing a lot of families starting to have to make difficult decisions in regards to, can they stay in our community any longer because it's getting so expensive. So we can be a bridge for that for a while, and that's what we're built to do. But from a long-term standpoint, it's really hard to create long-term stability in housing until there's some bigger changes across the board.
Okay, I see your program outcome 2 is 35% of participants will increase their CFSA score in housing upon reassessment. Is that sort of aspirational, or is it based on an increase in historical outcomes, or sort of where you're getting the 35% there?
So we do have 2 programs that are built fairly well for housing stability. One is our HSP program, which is housing stabilization through Boulder County. And then through the City of Longmont, we have a homesteading contract, which both programs are very similar in many ways. They allow us to pay multiple months of rent assistance and other assistance. So a family then can not have to worry about housing, not worry about, are we going to get kicked out? And they can focus on other goals, whether it's job, educational, getting stable childcare so they can go to work. There's a lot of factors that go into that, but we have those two programs that are pretty successful at helping increase that stability in housing. So I would say most of that 35% is going to be a product of those two programs that we do at the county and the city.
Cool. Okay. Thanks, Mark. Appreciate
You're
your
welcome.
work.
Great questions. Thank you.
So Mark, you've heard, I mean, as you know, you've heard this before at our last presentation, you know, as the board looks at your program outcomes and program activities, ensuring they're aligned with the city of Longmont's activities that the board has voted on. My job is to look at the agency level type of strategic goals, your collaborations, your finances. And I think you know, when I look at my scores, I think about, you know, I know you're working on your reserves, and I know you're working on it. So talk to me a little bit about, you know, I love your strategic goals that you shared. What, at the same time, we just heard from another agency that individual donors are going down because of inflation. What are some of the strategies or thoughts that you and the board are looking at to ensure that, you know, that you continue to serve as you see an influx, in particular in the basic needs? Last time we were talking about the Aspen Center, as we see, and we've talked about this, you know, second, third time repeats coming in for assistance. What's the financial plan strategy for that?
Sure. So again, during the pandemic, we were very fortunate that the city, you know, the residents of Longmont and the St. Vrain Valley just really stepped up and looked to us and supported us and financially really supported us during the pandemic. And so much so that, one, we were able to achieve some of our reserve goals where, you know, if there is a downturn, you know, depending on how significant that downturn is in regards to giving, we're not all of a sudden going to find ourselves financially as an organization in a tailspin. We can weather a storm for a little while, which is a great position to be in because we have not been there for at least my time there and longer. So from that standpoint, we're stable. We're in a good position to continue to march forward. And at the same time, our leadership team and our board made a commitment that as those financial donations came in, we started to put them away into a reserve account. We said, you know, someday we're probably going to need to pull these out for direct financial assistance. So our strategy has been all along during the pandemic that we're going to put that money aside and tap into it last. And when there's money out there from the county and the feds, the ARPA dollars, the ERAP dollars, the Emergency Rent Assistance Program dollars, we were going to use all of that first because that was coming from the outside in to support our communities. And as that is starting to wind up and dwindle down, we still have contracts we positioned ourselves with the county for direct financial assistance. We have about $500,000 put away for direct financial assistance, and we could actually tap into a little bit more if need be. We've also negotiated additional ARPA funds from the county for direct financial assistance. And then we also built up our Salvation Army funds that we help raise the funds. They go to the Salvation Army, and then we can make the referrals to the Salvation Army for rent and utility assistance. And we've really built that up to a point where they said, start spending that money. We want you to spend that down. So we have different avenues that we've really built up over the course of the 2.5 years, waiting for the moment that we think is probably going to be right around January when a lot of the federal dollars evaporate and people are going to have to they're going to continue to look at us with those high needs. And we've got some of the resources that we feel comfortable for, you know, at least the next year, we can continue to be strong in supporting the community and their needs.
That's good to hear. Thank you.
You're welcome. Thank you.
You know, I also want to, you know, I always point this out. I want to put kudos to your work on the diversifying your board. Just, I mean, Catherine heard this, but just for Graham's sake, talk about the work that you've done around that, because I know that that your diversity has increased. How are you going to maintain and increase that?
Yeah, so right around just before the beginning of the pandemic, my previous board president her goal was to make sure before her term was up to really focus on diversifying the board, bringing in different perspectives, making sure that different parts of the community that we serve were represented on our board. And through her efforts, we've added 2 members that are from the Latinx or the Mexican community. We've added 2 members, or we had 2 members that were African American. One of them just recently came off because he termed out. And then we also have 1 member who identifies with the LGBTQ community. So we've worked really hard to diversify. Can we get better? Of course, but I think we've done a really nice job. And I know our current chair and our board are committed. And they continue to have conversations that as they're doing recruiting, that should be one of the, the factors, the needs that we have. What's the skill set we're looking for, and then what's the perspective that they can bring into our organization that would represent different groups in the community. So our board is very committed to making sure that what Julia had created, we continue moving forward with our board.
Awesome. Any other questions from the board? All right, I had most of my questions answered. Since I look at the agency level, I had most of my questions answered at your agency hearing, Mark. So we got about almost 6 minutes left. Anything else you want to share?
Sure. I've been going out and beating the drum with everyone, letting the community know that it's feeling like the pandemic is in the rearview mirror for many of us, and I feel like a lot of us may be thinking and hoping and feeling that it's getting smaller in the rearview mirror. But as the Family Resource Center, we learned through the flood that we're the last to see the devastating effects of a crisis like a pandemic, leave the community. And we're still working with 10 to 12 families a week that are still reeling and are still trying to recover from the pandemic, whether they lost their jobs, they were furloughed, they racked up credit cards to get through that time, whatever the case may be. We're still seeing 10 to 12 families. And we're also the first to see a crisis as it's building. And I think the lights are getting brighter and brighter every day, and people are seeing that inflation is crushing families right now. We're seeing approximately 25 to 30% of the families that we see, according to my resource specialist team, brand new to the Hours Center. They were making it, they were doing okay just a year ago, maybe a year and a half ago, but now they can't keep up with the cost of living in Boulder County. The housing, we're seeing housing going up anywhere between $200 and $400 a month in rent. And then you add the cost of gasoline and groceries that you all are seeing as well. We have the unenviable position of we're still working through the previous crisis, the pandemic, and we're seeing this other crisis in the way of inflation starting to increase rapidly in our community. So again, to Eliberto's question earlier, we worked really hard. We didn't expect inflation to be out there on the horizon, but I think we've done a really nice job of preparing ourselves for this situation, kind of where these crossroads are all meeting. And, I know it kind of sounds like a little bit of a sales point, but we can only do it with great funders such as the city of Longmont, Boulder County, et cetera. That helps keep us strong as we're continuing to do everything we can to support the community. So that's kind of what I've been telling people is there's a lot of people still hurting, and maybe even more so now than even during the pandemic. So
Mark, you bring up a good point. And again, since we have this time, I've been, because through our homesteading contract, part of the contract for the board to know is I meet monthly with the homesteading person over at the Hours Center, and I present to the board on a quarterly basis on homesteading. What I've been hearing lately, and love to get your take on it, is when it comes to increasing rent, part of some of the challenges, I'm not going to say it's, I don't know how prevalent it is the reality of landlords just opting to not renew a lease because they feel that they can, that maybe the current the current tenant won't be able to afford, or they want to charge even more. Can you talk to a little bit about that, Mark?
Yeah, I mean, you're spot on with that. The team's been telling us for a couple months now that participants are coming in with a couple different scenarios they're dealing with. One, they're being told that, and when their lease is up in 30, 60, 90 days, whatever the case may be, that their rents will be going up anywhere from $200 to $400. We've heard as high as 800 in our other parts of the county, but not with us so far, knock on wood, but they're basically raising the rents. Landlords appear to feel that they can get that in the market, so they're raising those rents. We've also seen a couple cases where, coming out of the pandemic, some landlords, private landlords, just like families who own not the bigger corporations, are selling their assets. They're selling high right now. They're trying to get out of it. They struggled. Some of them struggled during the eviction moratorium because they were counting on that revenue. So some landlords have said, we're selling the property. Sorry, we don't have a place for you when it sells. And then the last point that Eliberto brought up is, we have heard of at least one landlord for sure that has said, because you access the ERAP funds, which was the federal assistance rent program, we're not going to renew your lease when it comes time to renew. And the concern is because if they couldn't pay for it before, they're assuming they're not going to be able to pay for it moving forward, and they don't want to assume that risk. Again, they feel that they can bring in other tenants that they feel they can better trust to make their monthly rent payments. So yes, we are seeing those three different scenarios coming to our building quite frequently at this point.
All right. Thank you, Mark. I just want to share that. We got about 50 seconds. Any last statement, Mark? Or if not, we can be good. We can be done early too. Nothing wrong with that.
Yeah, no, I think we've covered a lot of the high points. So yeah, again, thank you for taking the time and reviewing all these applications. It's greatly appreciated. And again, thank you to the City of Longmont for the support that you provide us, because we can't do it without everyone's help. So we appreciate that.
All right. Have a good night. Thank you.
All right. Thanks, guys. Have a good evening. Take care.
Okay. So I'm not sure if they're already here, Brenda, but just again, because they have 3 programs, we'll do 7 minutes each. I will time them all. And so hopefully we'll be done by 6:40, 6:45 at the latest. Is that good?
Sounds good.
Are they here yet?
Yes, they are. Okay.
All right.
Let them in.
I'll explain to them as well.
Hi, Alberto, Zoe.
Hey, Zoe. Hey, Lisa. Hey, Bill. How are you all?
Good. How are you?
Good, good. So, you're in a very unique situation. You're the first agency that's had 3 programs at the same time. So we're gonna do it a little differently. Typically, we give you 50 minutes if you have 1 program. We give you 10 minutes if you have 2. But because you have 3, we're gonna give you 7 minutes of program. So I'm gonna set a timer for 21 minutes. Just want to be consistent that, as we, when you have 2 programs, we go a little bit less, mainly because we're going to cover all the agency piece once, my questions, and then we'll just get to the program piece. So I'm going to set a timer for 21 minutes. And the fact is we may not even use all that, but I'm going to set a timer for 21 minutes. And we will, we'll go through, we'll start with the way that I have it on my list. We'll start with, I'm going to kind of take a little bit of lead here. I have mobility options first, then we'll go to your paratransit, and we will finish off with your food delivery program. So we're going to work through those 3 programs, again, 7 minutes each. But before we do that, just a couple of housekeeping. As a reminder, this is a public hearing. It is being recorded and will be on our City of Longmont YouTube for you all to review. And I'm going to introduce our board members, and then we will start the time. Before we start the timer, I'm going to turn it over to you to introduce yourselves. And then once that's done, we will start the timer. So let me introduce Graham is our vice chair, and Kimberly and Catherine are our board members. Typically, I know you all see more board members, but this year we did it a little different. We allowed the board members to choose which priority areas that they wanted to review and evaluate, with the idea that if they have to read less applications, they can go deeper into the applications than when you got to read all 50 some that come our way. So that was the idea, was to give board members less applications to read. And I will say we've had some very deep, meaningful conversations with our agency so far. So let me turn over to you, Lisa. Go ahead and start introducing yourselves, and then we'll start the timer.
My name is Lisa Bitzer, and I'm the Director of Operations here at VIA.
Bill Patterson, I'm the CFO.
Zoe DeVito, Director of Development.
Oh. Hopefully we didn't lose Zoe. Did we lose you?
Sorry, I do have a little bit of a poor connection. Did you ask me a question, Alberto?
Oh, just wanted to make sure we hadn't lost you, Zoe.
Yes, Zoe DeVito, Director of Development and Communications. Nice to meet you all virtually.
All right, great. So I'm going to go ahead and start. So again, for board members, we're starting with the mobility options program. If you have questions around that, and I'll interlace some agency questions that I'll only ask once as we go through this whole process. And here we go.
I had a point of clarification. It looks like you're requesting 209,000, but then I look at your program specifics and it doesn't quite add up to that.
So I can actually, I'm going to answer that for them.
Oh, sorry. Okay.
Because so VIA's funding is interesting, because even though community services has handled the contract, they also get an award from the transportation department of 150,000, and I you know, so, and when they just put that, so they put it into the application, but they're not asking that of the human services fund. They're asking that of transportation, and transportation does its own, however they do their allocation. That is not in our purview. We just happen to manage the contract.
Okay, very good. That makes way more sense now. All right, I guess I have two questions, and they kind of transcend the programs. One is, it looks like you don't have program partners, and that's a bit, I guess, a bit confusing to me. Can you talk to me about what that is?
Is that for the mobility?
Well, for all of them I see in your application, I'm just looking at your application in terms of the program outputs and activities and indicators, basically your logic model stuff. And it has a question about organizations that you'll work with to achieve program goals. And it says none identified on 2 of the 3 program activities. So I guess that's paratransit and mobility options.
Yeah, we do those, you know, we perform those activities in the county and in the city of Longmont. But we do, you know, we do work with others. So maybe we weren't clear on the question. People like Longmont Housing Authority and gosh, so many different you know, True Community Care, who's in Lafayette, but we're bringing and taking a lot of people in and out of Longmont for that. Lisa's going to be way better at talking about, you know, the partnerships we have.
Okay.
Yeah.
Okay. Do y'all, Lisa, do y'all work with Center for People with Disabilities or our center or Cultivate or El Comité or any of those
Yes.
folks who, yeah. Okay.
Yes, we work with CPWD. In fact, we worked with them last year to do COVID vaccinations. And then we do work with El Comité. In fact, we have an event that we're doing at their facility on Saturday for their health fair. So yes, we do work with them and attend their functions.
Okay, awesome. Thank you. And then my second and final question has to do with, do you track and do you know what your denial rates and no-show rates are?
We do. Right now, for the city of Longmont, our denial rates are up there. You know, everybody wants to use us. They love our door-through-door service, but we are limited due to the funding that we get on how much service that we can provide. So we do track our denials and we do track our no-shows and same-day cancels.
Okay, and it's the the reasons are primarily financial, it sounds like.
Yeah, it's an expensive service to run, being door through door, and we can only provide what we can afford, being a private nonprofit.
Okay, thank you both for your hard work. I appreciate it.
Thank you.
So that actually engenders a question for me, Lisa. So I guess the question around partnerships and denials is, are there any partners that you're aware of in the area that when you have to deny, you can tell folks, reach out to this agency, potentially they're able to help you?
Right, so that's our mobility department. So when we can't provide a ride when someone calls into the call center, if they're looking for other options or for other needs, we pass them over to the mobility department that I oversee. And they have a huge resource, whether it be looking for food stamps, housing, cancer treatment, whatever the case may be, including other transportation companies. We give them all those options, and we do what is called an ITP, an individual travel plan, and that lets them, it's a written document that we either mail to them or we go ahead and email to them so that they can have that for future use, to contact who they need to contact in case VIA can't assist in giving them the trip.
And so that's part of the program Ask for Mobility Options. That's the work that we're covering with the mobility options.
Yes.
Application.
They're registering new clients. We've been averaging the last couple of months over our entire service area about 400 to 420 new riders every single month, and that meet our qualifications of 60 plus and or have a disability. And then they do that for everyone, and anyone just calling in for information. Could be a loved one wanting to know someone that's out of town, they want to know for their loved one here in Boulder County or in Longmont, and we go ahead and give them the tools in which they need to be able to get the service. Sort of a one-stop shop, I guess you can consider it.
Okay. So I have another question. So just caveat this, and again, this is why we don't need 50 minutes for each program, because Graham's question just talked about two different programs. My question is at the agency level. So the caveat is basically, we get the same application, but the board and board looks at the program levels as per, Graham's questions around program outcomes. That's because that's what the board is looking at. I tend to look as staff at agency level type questions and financial levels type questions. And the one question I did have, I look at a lot of applications, and what I noticed from your proposed budget and it is really that VIA seems to be a government heavy organization, whether it be government contracts, government funding, and just wondering, what work is done, or maybe that is the model. I mean, that could be the model. There are agencies whose model is government based around continuing to increase that individual donation, that those other sources of revenue. So maybe Bill, this is a question for you.
Sure. And Zoe can talk a little bit too. We do fundraising. We have fundraising for our paratransit and our mobility management services. It's what we call here our mission-based services. We also operate under a social enterprise business model, which means that we have external contracts that we consider to be mission-based, but they're for-profit contracts. So things like running the HOP bus service in Boulder, being one of RTD's contractors on Access-a-Ride and FlexRide, which help us to carry, some of our overhead costs, as well as, when needed, making up deficits in our mission services. We're trying, anymore, we have lots and lots of needs, and it's hard to have, be able to devote a ton of that money toward the mission services, the founding mission of paratransit. Even though some of the other contracts we have are also paratransit, but those contracts are set up to, more than pay for themselves and generate some amount of excess. So between the fundraising and the separate contracts, that really helps our agency stay strong and run the business model. True, we do have, federal funding, state funding, the cities, the counties. It's a diversified basket of funding, which is helpful. Then when we look at each individual location and place that we perform service, so when we come to you with our request, we're looking at, well, what's the service we do in the city of Longmont? And between the other funding we have that we can devote to that, federal funding, county funding, some of the donations and contributions, what more, so looking to see what can Longmont help us too. And you all have been very good about helping us for many years.
Awesome. And just so you're all aware, we are past the 14-minute mark. So now we are into the, if you have questions about the paratransit, we can take those now. Go ahead, Kimberly.
I have a question. I'm not sure where it falls, but when I was reviewing the application, it talked about the Riders Advisory Council, which I thought was such a great idea about engagement with at-risk community members. I know that the plan was to create that in 2019. I'm just curious, or it was created in 2019, if what progress has been made and what outcomes have come from that advisory council.
I'm happy to speak to that. Hi, everyone. Again, so with Director of Development and Communications, our Writers Advisory Council was established in 2018, and we met quarterly in 2018 through 2019, and we had paused because of the pandemic. The outcomes of that functioned very similarly to a focus group where our writers, caregivers, yes, it was our writers and our caregivers, a group of about, what do we have, 8 different individuals who engage with VIA services, get together and give us feedback on some of our plans. At the time, we were preparing to transition software, and so we shared that software with them. We got their insights. That was very helpful. For example, one of our writers is visually impaired. He is blind, and his feedback for using the software with his screen reader device, his technology, really gave us very valuable insights.
Oh, you're kind of breaking up, Zoe.
Into what the user experience would be like for. Oh, I do apologize. I'm out in the country right now, so please just let me know. Anyway, we are reestablishing our Writers Advisory Council, which will have a different name early next year. It will include writers, caregivers, and also I would like to get some of our frontline staff engaged with that as well. For example, drivers. And we will share our different communications pieces, things like instructions on how to use our new software whenever we switch over to that next year. And by doing this, the feedback that we receive from our community members who engage with us every day, we will continually develop and improve our materials, so that way we are serving our community the very best way that we can. That is the whole idea behind that, and we have identified about 6 individuals. I'm looking to get closer to 10 involved next year, and yes, we will be meeting quarterly for that, so we will be picking that back up.
Thank you. I'm stepping a little bit out of bounds and talking about programmatic questions, but and I think we're going to get this email soon because I asked for it. On the program demographics, how many clients from Mobility Option, Lisa, do you project will be Longmont folks, or do you track that?
I do. So Longmont is growing. We average about 35 new riders every month just in the city of Longmont. I continue to see that grow, especially when wintertime comes, the weather gets colder, the snow starts to fall. And more people seem to need our service. There's certainly not a stop on, I can remember several years ago when I started, if we had a couple of hundred people a month registering, that was really good. And now we're over 400 a month over our entire service. So the need continues to grow. We'd love to be there to be able to support the people that need us, especially the ones that need that specialized service of door through door.
Right, that paratransit piece. So just time check, we're at the 7-minute mark. I'm not sure there's any more questions for the paratransit piece, but we're gonna turn now to the food delivery piece. And I'm not sure if anyone has questions about the food delivery piece, because I do, but I want to make sure if the board has any. Okay, so then let me start with some questions, because I asked the same question to, just so you know, I asked it to Boulder County Farmers Market, just because I think it's a question that needs to be asked. And I also actually I've asked Community Food Share too, the same question, because there's a lot of food delivery happening right now. And I understand there's different populations, different niches, but can you talk about to the continued need and any conversations about collaboration, deduplicating services, where can we coordinate or where can you all coordinate as providers to ensure that we're not duplicating each other's services?
I can answer that. So I don't believe we're duplicating services, especially with the Boulder County Farmers Market. These are people that depend on us. I don't believe that COVID is over. In fact, I just read yesterday that there's a new variant. They expect it to grow and cause a problem in America this winter as the flu and cold season comes. Some people have children they can't get to or don't have a vehicle at their disposal to come get food, and to get good nutritional food is so important. And a lot of people, one, can't afford it, especially with the grocery prices raising these days, and being able to bring it to them. We try to use volunteer drivers whenever possible, but sometimes we have to use our paid drivers. And then, of course, with Community Food Share, Harvest of Hope, we work with them as well. And it's for people that are having a hard time getting out of their house for multiple reasons, and so that we can get them the food and the nutrition that they need.
Okay.
So I do see a need.
Okay, and do you guys, I guess this is more just again, I'm getting into the programmatic piece, but do you guys use, when you pick up these, are you using your big vehicles to pick, or are they big pickups, or?
Some of them are. But we try to use our Priuses and our Ford Edge to do that. And so you can put down the back seat in the Ford Edge, and you can put about 35 to 40 bags of food in that. So that's, each one is a delivery. And so we do that. So we try to be as careful and mindful as we can as far as what vehicles we're using. We don't use our big body on chassis buses. I think the biggest one we've ever used is our 8-passenger transit van. But we do our very best to use Priuses and our Ford Edge. They're fuel efficient, and they can hold quite a bit of groceries.
Okay, and this question may be for Zoe. It's about the food piece. When I look at your program budget, and I look at your mobility, we the human services fund of it. I mean, I know you get a big chunk from transportation for your paratransit. When I look at your budget for mobility options and your paratransit, we make up a very small amount of that budget. But when I look at your food delivery budget, I am a little concerned that if the numbers that you presented are correct, we make up about 28% of that budget. So that's a little bit, for me, concerning to see that the City of Longmont Human Services Fund representing that much of a program budget. Zoe, what are the plans to diversify the revenue sources for that program so that we don't make up such a big piece of it?
I can speak very minimally to this. My role has changed, and Bill may have more information. We are also applying for other sources, private foundations, government sources as well. we do a significant amount of deliveries within Longmont, and I think that that is reflective of our budget request, but Bill might have more information.
Yeah, that's all true. And what you said, Alberto, as well. I mean, we do have a good basket of funding for paratransit. Not that we don't need more. I mean, we have miles every day, but we don't have a lot of funding. And in fact, we did during the pandemic, we did the food delivery with no funding. So we kind of just took it out of our other things. And sadly, we can't use our transportation funding for delivering food. So, and the fact that, as Zoe said, a large, and maybe Lisa knows percentage, a large portion of the food deliveries are in Longmont. And hence between us and the farmers market and the other partners, we're trying to put together a lasting funding model that can help us, carry this on as long as it needs to carry on.
Okay. All right. I just wanted to share my concern because typically when I see that high at 20, anything above 20% concerns me as far as sustainability is concerned. Because if the board chooses a different priorities, et cetera, that could be a major hit, right? So yeah, I just wanted to share I shared my concerns with the farmers market as well, because we're expected to fund a big part of their program, and it's like, what's the plan to make sure you all are sustainable, because just want to be upfront about that.
Thank you for clarifying. Thank you.
Yeah, no worries. We got about a minute left. Anything, Lisa, Bill, Zoe, that you want to share with us? Any other questions the board has?
Thank you very much for your consideration and your partnership.
All right. Well, you know what? 21 minutes worked out just fine. We got through all our questions, and I really appreciate your time tonight. And yeah, I'm just waiting for, I think, is it Ryan? Ryan's going to send us the program demographic piece for the individual program. So I appreciate that.
Perfect.
All right. Have a good night.
Very much. It was great to be with you tonight. Thank you for all your service. I saw you have a 3-hour meeting tonight. That's a heck of a meeting.
Yeah, we've had some meetings for sure.
Take care, everyone.
Thank you.
Bye-bye.
So I think I think we are done tonight. Thank you all. Again, quick reminder, October 31st, so I can do that, and so I can bring I must say, we might have to have some difficult conversations at the November meeting, as the amount that being asked for is about 500,000 more than what we have. So just want to be, there are some that are going to hit limits, and that might help, but to be aware of that I don't think last year we couldn't spend it all. This year we might have to have some difficult conversations about how our allocation formula lays it all out, and what we can do formulaically is that even a word? Anyway, to address that the ask, because it's been one of the highest since I've been around. I think we at one point there was like $2.1 million asked, and we only had 1.4. So just to let you all know that we're gonna have to have those conversations. All right, thank you. Have a great night.
Thank you. Good night.
Thanks, everyone.
Thank you, everybody. Good
Night.
Night.